Good afternoon and welcome to our OakBend Medical Center Happy Hour podcast. My name is Donna and I am your host. Our special guest today, you may recognize from his COVID updates on social media, his involvement in the community, and his numerous television appearances. We welcome Joe Freudenberger, CEO of OakBend Medical Center, to talk about the benefits of our hospital in the community. Welcome, Joe.
Thank you for having me, Donna. It's a pleasure.
We're excited to having you today because we always hear about COVID. So do you want to give us a quick update on COVID in Oak Bend?
Absolutely love to. Good news is our numbers are substantially down. We peaked at almost 40 COVID patients in-house in January. And I am proud to say that at this point, we are in the single digits, and I hope to see that continue to decline, though I will advise everybody that the best way we can ensure that continues to happen is, one, people get their vaccinations, and two, people take precautions when they're around other folks. The most common form of spread is droplets, generally from friends and family to each other.
Great advice. And we still see a lot of our people in the community wearing their masks and taking precautions. So we're very happy that they are participating in keeping our community safe. So, Joe, Oak Bend has been a very important part of our community for many years. And it has been built on community. Do you want to talk about what Oak Bend means to the community and the community means to Oak Bend?
We were established in 1947 to provide high-quality health care locally. And that was intended to serve not only the population of our community that had the wherewithal to find healthcare in other parts of the Houston area, but also to allow the folks that didn't have access to healthcare to receive good quality services. And I'm proud to say that since our opening in 1950, we have continued that mission and continue that mission today. We are what is called a safety net hospital. We serve the entire population, and we ensure that there is a net underneath the healthcare system that people that do not have resources have a place to go to get quality healthcare and to ensure that they are living life to the fullest that they can. Community is everything to us. We are dedicated to the Richmond, Rosenberg, and Wharton communities. We use facilities in other communities to fund our mission of care to the entirety of our community, so that we can ensure we remain independent and dedicated to our communities.
So is it true that there are some services that we offer to our community that are a real need to the community? We necessarily it may not be in our best interest to offer them.
Well, it's in our best interest to offer them in the context of our commitment to providing services to the community. I think what you're asking is it financially prudent? And I will grant you that there are certain service lines that don't make as much money as others. That is a reason that many of our competitors do not offer them. For example, we have a hospital-based skilled nursing facility. There are no other hospital-based skilled nursing facilities in Fort Bend County, and I think there's only 2 of them in the greater Houston area, because they do not produce much in the way of a profit, and in many times, and in many years, they lose money. We believe that it is best for the patient to recover from an illness or injury in their local community, and that's why we offer it here at Oak Bend. It is a high quality, almost a rehab level of service that we offer here. Unit for our elderly that have mental health issues, which is not a sexy service line, but we believe that it's important, especially when there are medically complex patients to begin with, which a typical mental health oriented hospital would not have the skills to be able to address. We have an air ambulance that's based here all the time. And I can go on and on about our service lines that are unique to Oak Bend, most notably our no-wait emergency department, which is not only a benefit to the community, but it is state-of-the-art emergency medicine model of care. So we do a lot of wonderful things, and they are a byproduct of us tailoring our services to meet the needs of our community.
So I personally want to thank you for having the skilled unit in some of these services because my family has needed them over the years. And it has been very beneficial to my family and myself to have my family close to home. So I want to thank you for providing those services, even though they may not be viable for the hospital to have. So when we talk about this, it comes to we have to make money to be able to keep these services afloat for our community.
Right.
And OakBend has come up with several ways in order for community members to get involved.
Yes.
Because that's what it takes, right?
Yes. It takes a village.
Right. So do we want to talk about the services or the programs where the community can get involved and how our hospital gets involved?
So what's upcoming in April is our OakBend Restaurant Weeks program. So we are having events at local restaurants over the course of this time that are reasonably priced, and the proceeds go to OakBend. And we hope to make $25,000 with these events. The first of which is a wonderful event at Swinging Door, Brews and Cues. And Steve Onstead, the owner of Swinging Door, is using some personal recipes of his own. It's not your standard fare, chicken and sausage and brisket. This is unique barbecue dishes that he personally is going to make up for us, along with the fixins, and a local brewery is going to be providing the suds. And we're going to have live music, a great time at Swinging Door. And it's reasonably priced at $50 a head. Following that, we have a fish fry at the McCarty's home on Hillcrest. Amazing food, full bar, a can't miss event. And then I have to say, the highlight of this weekend, crawfish cooked by yours truly. Now, I have to warn you, Donna, once you've had my crawfish, you can never go back. The crawfish that you buy at another restaurant is just going to taste plain to you. So the only warning I give is it is going to ruin you for any crawfish you might buy in a restaurant. But it is $45 a head. I'm contributing everything to this, and all the proceeds go to the hospital.
But I have to agree with you. If you've never had Joe's crawfish, you need to get it. People rave on it. We usually have a full crowd when we have it.
Yes.
So this is one event you don't want to miss.
So we've got 10 events like this. They're on our website, oakbendmedcenter.org. Look under Restaurant Weeks, and you can find all the events that we're putting on over the course of the next 4 weeks. They range from the 3 that I just described to dinners at people's homes, dinner at the Black Hawk Country Club. They're great food, great camaraderie, a great time, and an even greater cause, our safety net hospital, which wouldn't exist without the support of our community.
So where do I get a ticket for all this?
On our website, Donna, oakbendmedcenter.org. Look under Restaurant Weeks.
Okay, so we just go online, get us a ticket, or can we pay at the door?
You can pay at the door too. We will have people who are able to process your credit card at the door.
Awesome. Let's all participate in this. It's a great thing for our hospital and our community. We're also selling quilt squares for 2020 for the memory quilt.
Yes.
To kind of pay tribute to our loved ones and stuff.
Yes.
And I understand the proceeds from this go to a new program called Branches.
Yes. The Branches program is designed to provide children who do not have insurance and who do not qualify for insurance an opportunity for their bill to be written off after they have received their emergency department care. As you know, people receive these high bills that come out of emergency departments, and it can be a crippling situation. And we're pleased that our employees have contributed $50,000 so that we have a pool of money that can be used to offset the cost of this emergency department care for those kids from ages 0 to 18 who do not have insurance and do not qualify for any other insurance. So we're excited that the quilt squares that are being sold now will enhance that pool of money because, as you can imagine, $50,000 is good, but it doesn't go a whole long ways. And we would want to make sure that everybody that we can this year has their bill written off if they qualify for the program.
So you can also go on the website and find out how you can get a quilt square. This will hang in our atrium once Pat Aper has put together all the squares. It's a beautiful tribute to those that we've lost, happy times, sad times, anything you want to have remembered.
Couldn't agree with you more, Donna. Every time I walk by one of our quilts and I see my parents' name or my wife and our family name up there, it reminds me of why we support this great institution.
It's also a great support for our staff.
Yes.
Because they see the communities 100% behind them, and the momentum, especially this last year, helped keep our staff going through
Absolutely.
some really troubled times because it's for our community. I don't want the community to think we depend on them solely. Let's talk about the board, the staff, the physicians who volunteer to help our organization be so great. Because yes, they do work here, but they also contribute their time, finances, and everything else to helping OakBend.
Yeah, we have an amazing folks that work and serve OakBend. You start with our board of 11 members of the community who volunteer their time graciously and a great deal of time involved to govern this organization, ensure that we stay true to our purpose and our mission. We continue to thrive financially, and we raise the money necessary to continue to reinvest in the services and equipment that is so important to providing quality health care. We have an amazing executive and leadership team of folks that are committed to our purpose. Many of them have been with us for over a decade, and if you know anything about healthcare operations, you know that continuity of leadership is essential to the good quality of care that an institution can provide. And then our staff are just amazing people. They're amazing as individuals. They're amazing as a group. They create a culture of kindness and consideration that is so important when you are receiving health care, because it's a difficult time for all of us, and to have the warmth that comes from our staff is uplifting and helps people heal faster. And I got to give a shout out to every single one of our staff members this year for having soldiered through, and I use that word soldiered through because it's been a battle, Donna. It's been a real battle this year with COVID, and they have soldiered through and maintained great services in the face of crazy challenges to their own health. Thankfully, none of them have gotten ill at work, and they've provided great care to our patients. And it makes me so proud to be a part of this institution and what we've been able to do and what they have been able to do in serving our community this year.
And then our physicians also get involved, philanthropy and contributing. This year we had a freeze, unlike any freeze that we've ever seen. Joe, do you want to talk about how our physicians and staff stayed at the hospital just to make sure that we would be here for our patients?
Well, I want to talk about our physicians in two respects. Number one, I want to express my appreciation for their leadership during COVID. We formed up a task force that was led by our physicians, and every week we get on this Zoom call and we go over the latest protocols. There's great conversation, there's great camaraderie, and there's great collaboration, and they have been the leaders that have given us the guidance that enables us to provide these high quality healthcare services during this pandemic. And we talk about the freeze, which was challenging. I got to thank our physicians who stayed in-house to ensure that we could provide continuity of care, and who soldiered through. And again, it's a soldiering through a crazy situation when we just got overwhelmed with patients who needed everything from dialysis to oxygen to care for major health conditions that arose during this. Just because the roads are closed and everything is shut down doesn't mean that people's health needs stop. And our medical staff was amazing. It is something that makes me, again, very proud to be part of this organization and to work in collaboration with a committed group of physicians dedicated to high quality care locally provided.
I understand that during the freeze, we even worked with EMS and had a warming station for those that needed electricity for their oxygen and to just stay warm, which was totally amazing to hear that a hospital that's already inundated with patients could open up their doors and take care of that. And I understand our staff were feeding and providing refreshments for them. It was really a heartwarming time.
We seek to collaborate with all first responders, police, fire, EMS, because it takes a whole group of folks to serve a community. It's not, we cannot silo ourselves. We work in great collaboration with them. I'm very proud of the work that we do together to serve our community. And our staff, you know, I characterize them as Marines. They improvise, and we found a need for that our community required at that point in time, and we figured out a way to deliver on it.
So, Joe, we have all these great things, and like you said, it takes a village to make this happen. As a community member, what can we do to help? What things can we contribute?
So the first thing I ask everybody to do is, if you know a healthcare worker, whether they work at OakBend or somewhere else, give them a heartfelt thank you, because that's the lifeblood that keeps people coming back and doing the heavy lift that's involved in caring for the ill, especially when their own health is in jeopardy by doing so. We give a lot of thanks to a lot of people, but I'm telling you right now, the first one should go out to our healthcare staff. As far as the community, beyond saying thank you, use your local facility. Use OakBend for your healthcare needs. That helps finance our safety net purpose. Give to OakBend where you can and join us in our events. And we have several. The Restaurant Weeks program coming up is the most recent, is the closest, but we have Power of the Purse, and then we have Patchwork in the fall. Anything that you can do to support our philanthropic, our nonprofit purpose is going to be greatly appreciated. And then I want to say thank you to everybody that has brought food to our staff and said thank you in such a meaningful way. Sharing food is something that goes back to, you know, the earliest days of humankind, and is something very powerful and very heartfelt and warm to receive. So thank you everybody who has supported our staff through the course of this pandemic.
Thank you, Joe. I know you touched on it, but I do want to touch one more time. We don't just ask the community to help us. We ourselves help ourselves. And our employee giving has grown over the years. Why is that so important that our employees are bought in, not just in spirit, but also putting their hard-earned money into the organization?
When you choose to invest your own money in our mission and our purpose, you are buying into the hospital. It is no longer just a place to work. It is now your hospital. And when we think about the challenges of healthcare, the illness that we deal with, the emotional drain that it places upon us, the physical challenges associated with staying on your feet and managing sometimes heavy folks, and the intellectual, I mean, dealing with the human body is the most complex organism on the face of the earth. You take all these challenges together, you've got to have something that brings you back to work. Otherwise, it just beats you up. And having a purpose, serving a community, which is a byproduct of making the decision to invest in OakBend by making a contribution, gives you that purpose. It is the energy that wakes you up in the morning and says, I want to get to work because I want to serve that purpose. And it helps us to run an efficient, effective, high-quality organization when everybody treats this place as their hospital, not simply a place to work. That is the value of investing and contributing to OakBend as an employee.
And last year, how much did our employees contribute to the organization?
Over $100,000 in spite of COVID. And we're looking to do $150,000 this year. And I am 100% confident we will achieve that objective.
I heard a rumor they're going to go over that 150.
I think you might be right. I've heard the same rumor.
I heard we can put you on a dunking booth if that happens.
You heard wrong.
Oh, okay. So, Joe, you're not just the CEO who sits in an office and goes home at 5 and plays golf and all that good stuff. You're a feet on the ground CEO, as is your family. We see them at all the events, participating, helping, working. Your wife has been a true advocate to a lot of our fundraisers, and thank you, Laura, for being that. She is also one of my secret shoppers whom I love dearly. But why? Why are y'all so involved?
It's just the way my family works. We get fully involved in each other's activities. It's OakBend is special to my family. I've been here for 14 years. I want to be here for another 14 years, health and God willing. But we all believe in the purpose of OakBend, and we love the community, and we love the hospital. My youngest son, who is now going to an ER residency program, effectively was raised by the medical staff and the staff of this hospital. I mean, without them and their guidance, Jake would not have had the inspiration to become the doctor he is. He's going to be an amazing ER doctor. We're all so proud of him. And I walk around the hospital, and more people ask me about my mom and my wife and my son more than they ask me about me. So this is our home. This is our hospital.
We met with Pat Abear on a podcast not too long ago about philanthropy, because her and Judge are so philanthropic in ways to give. We also have a volunteer program at OakBend, which has kind of settled down a little bit due to COVID and the safety of our volunteers. But that'll be starting back up here very soon. The gift shops will start to open and things will start. There's opportunities to volunteer, and there is no amount too small or too large to give from the heart. To be able to provide a child with services that the mother may not be able to afford it, but because we have this new program, Branches, she doesn't have to worry about, do I take him or do I not? That's amazing. And that's built on this community. Or to know that COVID's here and a lot of people have passed and we haven't gotten to do our closure or anything, but to know that you had a nurse that was sitting there holding your loved one's hand. And it didn't matter what insurance they had or anything. We were going to be here for them. That is amazing. And that takes community giving back also. Mm-hmm. I ask people to open their hearts. I ask people to see the wonderful mission. If you could see these employees wearing triple masks and sweating and wearing suits and doing CPR, they do this because of the love of their patients in this community. So community coming back is extremely important. Absolutely. So I've done my tantrum and I feel better now. Joe, is there anything you would like to add?
No, I just want to express my appreciation to you and your team, Donna, for putting these podcasts together. I've heard a lot of folks tell me how much they appreciate them. I want to thank our community, our medical staff, our staff for their support and the great work that they do. And I just, want to appreciate the honor it is for me to lead this organization.
And Joe, we want to thank you. One of the best leaders I've ever worked for. And being a fifth generation community member, he's one of the best things I've seen for this community. So our hats are off to you. Joe, I want to thank you for joining us today. And a big thank you to our listeners in tuning in. Beginning now, set an intention and a relentless focus on living your life as the greatest person you can be in all situations. I ask if you have any questions, you'd like to take a tour or anything, please reach out to our website. We will give you contact information at the end of this podcast. And please join us next week. Until then, have a great week. Thank you.
Thank you for joining us today on OakBend Medical Center Happy Hour podcast. We hope you enjoyed today's broadcast and invite you to email us at oakbendhappyhourpodcast@obmc.org with any questions or topics that you would like for us to cover. Remember, you can find us here each Friday at 5. Until next week, be mindful and stay healthy.